Hi, my name's Tim. I'm going to be the nurse today. I'm going to be performing a straight cath, and before we begin, I would perform hand hygiene, and then I would perform all general principles and safety practices, and make sure the bed's a good working level, and use 2 patient identifiers. Before the actual insertion of the catheter, I perform pericare, so I'm going to put on clean gloves, that are 2 sizes too small. And then I would grab a clean rag and some warm water with soap. I would grasp the penis and clean around the meatus until the area is clean using different corners of the rag. And after pericare is completed, I will discard of all the materials for that and discard of my clean gloves. So next I would go ahead and perform hand hygiene. And then I would go ahead and before I'd open all my sterile materials, I'd make sure that nothing has been tampered with or out of expiration. I would clean the area, and now I'm going to go ahead and open my catheter kit away from myself. So now I'm going to take my my sterile gloves, and I'd open them. I'm going to push my catheter kit away from me just a little bit for more working area. I might be able to get my sterile gloves on. So I'm going to put my sterile gloves on by starting with my non-dominant hand. So I'll put those on. Now I'm going to put on my dominant hand. Now that those are on, I'm going to discard of the wrapper since the inside was sterile. I'm going to use my elbow and get rid of the rag used for pericare. And now I'm going to take a clean drape and place it on my patient. I'm going to keep everything at a working level. Place the shiny side down since it's the waterproof barrier. Next, I will reach in and grab the diamond drape, and I will place it over my patient like so. Next, I will reach in and grab my cup and my lid and place them on my sterile field. Next, I'm going to go ahead and open my lube and the 3 cleansing sticks. I will open my lube, squeeze it in the bottom, and then I would discard of that. And I would have opened I'm going to open my 3 cleansing sticks. Once those are open, I would discard of the wrapper for that. So next I'm going to reach in and grab the iodine cleansing stick, and I'm going to grasp the penis with my non-dominant hand and clean around the meatus and the urethra 3 times with a new stick each time. So I would discard of that. Now this hand is contaminated, but I'm going to reach in and grab the stay. How would I do this? I'm having a hard time grabbing the catheter with one hand. I'm going to do it like this. So now, I would lubricate it, the tip of the catheter. Now I'm going to grab the penis again with this hand, and I'm going to insert it until I get a urine return. So then I would place it in my clean cup and let it drain in there. And once my sample is complete, I would, I'm trying to figure out how I would do this without my cup tipping over. So I'm going to keep that there, but I would take my hand and clamp this off, and then this would actually stay in there, but it's not going to for the purpose of this video. I'm going to reach over and grab that, and then I'd reach back up and place it back into the basin. That would have never happened, it being on the paper, but that is still sterile. So I would unrelease that, and I would let the bladder empty itself into the basin. And then once the bladder is emptied, I would go ahead and total up the urinary output of the sample cup and the basin. So then I would go ahead and remove the catheter from the patient, and discard all my supplies, and then I would put the lid on the cup, and I would label it with my name date and time, and that this was taken by a catheter, a sample, and I place it in a biohazard bag and send it down to the lab. So I'd clean up my area and come back in a little bit and reassess my patient, and I would document and report and record. Thank you.